Hello, everybody. My name is Nawabi, and today I'm going to talk about one of our ongoing studies titled The Effects of the COVID-19 Pandemic on Stroke Response Times, a Systematic Review and Meta-Analysis. We have nothing to disclose. So, as you all may know, the coronavirus disease 2019, or COVID-19 as it is commonly referred to, was first discovered in the Wuhan province of China in December of 2019. And has since grown to a global pandemic that, as of this recording, has infected more than 38 million people worldwide, claiming over 1 million lives. As many of you are also probably aware, the pandemic had unprecedented effects on healthcare systems around the world. Things like employee redeployment and redistribution, the cancellation of all elective surgeries, and the massive influx of COVID-19 patients completely changed the way healthcare professionals were able to provide care to all patients. The stroke population was perhaps put at unique risk by these negative effects of the virus. One of the most important, if not the most important factor of stroke patient care is immediate response to symptom presentation. The process of responding to a stroke is a carefully coordinated procedure that requires quick thinking and execution from multiple parties, including EMS and other first responders, the emergency department team, the stroke team, among others. This procedure was likely compromised by the logistical remodeling hospital systems around the country and around the world experienced as a result of the virus. Likewise, some patients likely delayed seeking medical attention after symptom onset because they feared the possibility of contracting COVID-19 when in the hospital. It is critical to understand how emergency stroke response has been affected by this pandemic to ensure that proper adjustments are made if ever needed in the future. After defining our study's inclusion and exclusion criteria, a systematic literature search will be conducted to search for articles that include stroke time metrics data during the COVID-19 era, which we have loosely defined as January to present, in PubMed, Embase, and the World Health Organization's COVID-19 database. We hope to collect data points like last known well to hospital arrival, door to needle, and door to reperfusion times from a wide variety of sources, with the intention of determining if these metrics increased during the pandemic. For each time to event outcome, pooled analyses will be calculated using a random effects model, and heterogeneity will be explored through meta-regression or subgroup analyses by covariates such as hospital location. As previously mentioned, our study is ongoing, and we cannot at this time provide final results. However, we do anticipate finding evidence that the COVID-19 pandemic increased stroke response times. A preliminary literature review supports this trend, with some hospitals reporting increases in stroke onset to door time, door to groin time, and door to CT time during the COVID pandemic. Included in this slide is an image depicting the golden hour for IV TPA administration. As you can see from the comment the authors included at the bottom, every second counts when responding to a stroke. To reiterate, it is very likely that stroke patients have experienced delays in emergency response during this pandemic. These delays could possibly be attributed to modified stroke response and depleted emergency personnel and resources, in turn caused by the influx of COVID-19 patients. It is our hope that performing this systematic review and meta-analysis will provide insights as to how the pandemic has affected the stroke population and may help determine how to improve stroke responses during future pandemics. Thank you all for your time and attention.